Let's imagine this together. You're caring for a patient who suddenly becomes short of breath. Their heart rate jumps up, their oxygen saturation drops, and they clutch their chest saying, "Something doesn't feel right." This could be a medical emergency, and one of the most critical possibilities to consider is a pulmonary embolism.
But before we begin, check out our extensive nurse test bank to help you pass nursing school and the NCLEX. Link is in the description below.
A pulmonary embolism, often called a PE, happens when a blood clot or other material blocks one or more arteries in the lungs. Think of it like a traffic jam in the pulmonary circulation. Blood can't flow freely, oxygen exchange is disrupted, and the heart suddenly has to work much harder to push blood through the blocked vessels. Most of the time, the clot forms elsewhere, usually in the deep veins of the legs, and then travels upward to the lungs. That's why you'll often hear pulmonary embolism linked with deep vein thrombosis, or DVT, as part of what we call venous thromboembolism. So, how do these clots form in the first place? There are a few classic contributing factors known as Virchow's triad, and it's worth remembering these three categories because they often come up on exams. First, you have venous stasis, which means slow or stagnant blood flow. This can happen when someone is immobile for long periods, such as being on bed rest, sitting through long flights, or recovering after surgery. Second, you have vessel wall injury, which can occur after trauma, surgery, or even central line placement. And third, you have hypercoagulability, which refers to conditions or medications that make the blood clot more easily, like cancer, pregnancy, birth control pills, smoking, or certain genetic clotting disorders. Now, in clinical settings, certain patients are just more at risk. Post-operative patients, especially after orthopedic or abdominal surgery, are prime examples. So are those with prolonged immobility, obesity, advanced age, or a history of clots. Even dehydration or heart failure can increase that risk. That's why nursing assessments and preventative measures are so critical in these cases. When a pulmonary embolism occurs, the signs and symptoms can appear suddenly and dramatically. One of the hallmark symptoms is sudden shortness of breath. The patient might look anxious, breathing rapidly, and say they can't catch their breath. You may also see pleuritic chest pain, which gets worse with deep breathing or coughing. Other signs can include tachycardia, low oxygen saturation, cough, sometimes with bloody sputum, and even a feeling of impending doom. A phrase that often appears in textbooks but is very real to patients experiencing this crisis. Sometimes the presentation is more subtle. A patient recovering from surgery might simply appear restless or mildly short of breath, and it's easy to attribute that to pain or anxiety. But as nurses, our job is to connect the dots. If you see shortness of breath, tachycardia, and low O2 levels in someone with risk factors, never ignore that combination. That's when you call for help immediately. Now let's talk about how we diagnose it. Since symptoms can mimic other conditions, like pneumonia or heart attack, diagnostic testing plays a huge role. A CT pulmonary angiogram is the gold standard. It provides detailed images of the blood vessels in the lungs to reveal clots. If a CT isn't possible due to allergies or renal issues, a VQ scan, ventilation perfusion scan, might be used. Other helpful tests include D-dimer levels, which indicate the presence of clot breakdown products in the blood. If that's elevated, it raises suspicion. ABG analysis can show low oxygen and low carbon dioxide due to hyperventilation. ECG might reveal tachycardia or right heart strain. Chest X-ray might be normal, or show nonspecific changes. An ultrasound of the legs may identify a deep vein thrombosis that's contributing to the problem. Once pulmonary embolism is suspected, it's a time-sensitive emergency. As nurses, our actions can truly make a difference in outcomes. The first priority is to ensure adequate oxygenation, apply oxygen as prescribed, and monitor SpO2 continuously. Keep the patient in semi-Fowler's position to promote easier breathing. You'll likely start or maintain IV access because the provider may order anticoagulants immediately. Heparin is the most common initial treatment. It prevents the clot from growing larger or new clots from forming. Low molecular weight heparins like enoxaparin are often used too, especially outside the ICU setting. Later, oral anticoagulants such as warfarin or newer drugs like apixaban or rivaroxaban may be prescribed for long-term therapy. In severe cases, if the clot is massive and causing shock or cardiac arrest, thrombolytic therapy, drugs like alteplase, may be used to dissolve it. But this treatment carries serious bleeding risks, so it's reserved for critical situations. Some patients may require surgical or catheter-directed thrombectomy, where the clot is physically removed, or placement of an inferior vena cava filter to prevent future clots from traveling to the lungs. Your nursing role involves vigilant monitoring during all of this. You'll be watching for changes in respiratory status, heart rate, blood pressure, mental status, and oxygen saturation. You'll need to report any new or worsening symptoms immediately, such as increasing dyspnea, chest pain, or restlessness. You'll also be checking for signs of bleeding if the patient is on anticoagulants. Look for bruising, bleeding gums, blood in the urine or stool, and monitor lab values like APTT, INR, and platelet count depending on the medication. Education is also a major nursing responsibility, especially once the patient stabilizes and transitions to oral therapy or home care. You'll want to teach them how to take anticoagulants safely. For example, if the patient is on warfarin, they should understand the importance of routine INR checks, maintaining consistent vitamin K intake, and avoiding over-the-counter medications that can increase bleeding risk, like aspirin or NSAIDs. Encourage patients to wear compression stockings, move around frequently, and avoid sitting for long periods. After surgery or during long travel, early ambulation and leg exercises are simple but effective preventive measures. Remind them to report any unexplained swelling, pain in the legs, or sudden shortness of breath immediately. From a psychological perspective, experiencing a pulmonary embolism can be terrifying. Anxiety is common, and reassurance plays a huge role. Explain what's happening in clear, calm language. Keep the patient informed about what tests are being done and what treatments are planned. Anxiety can worsen the sensation of breathlessness, so a calm, confident nurse can make a big difference. Let's bring it together with a quick visualization. Picture this. A 55-year-old patient recovering from knee replacement surgery begins to complain of sudden shortness of breath and chest pain. Their oxygen saturation drops to 88%, heart rate rises to 120 beats per minute, and they look visibly anxious. You administer oxygen, raise the head of the bed, and call the provider. Orders come in for stat labs, ECG, and a CT pulmonary angiogram. Soon, the diagnosis is confirmed: pulmonary embolism. Anticoagulation begins immediately. Your timely assessment and action just saved a life. That's the power of nursing vigilance. Even after discharge, your teaching continues. Encourage patients to stay hydrated, avoid crossing their legs for long periods, and understand that follow-up appointments and medication adherence are vital. Emphasize that anticoagulation therapy doesn't dissolve the existing clot. It simply prevents new ones from forming while the body gradually breaks it down on its own. In summary, pulmonary embolism is a condition where a clot blocks blood flow in the lungs, leading to life-threatening consequences if untreated. Recognizing risk factors early, responding quickly to symptoms, and providing comprehensive care and education can make all the difference between recovery and crisis. Every nurse plays a critical role, from prevention and detection to emergency response and long-term management. Well, that's it. Thanks for spending this time learning with me today. Keep studying, stay curious, and remember, every time you educate a patient about their medication, you're empowering them to take charge of their health and healing.